COVID-19 cases are rising sharply across the U.S., largely driven by the emergence of a new dominant strain, according to recent data from the Centers for Disease Control and Prevention (CDC). The updated map reveals that 5 southern and southwestern states, Arkansas, Louisiana, New Mexico, Oklahoma, and Texas, are experiencing the highest rates of infection. In these states, more than 25% of COVID tests are returning positive, indicating a significant surge in cases. This increase is attributed to the spread of the FLIRT subvariants, a group of highly infectious Omicron spin-offs that have become predominant across the U.S. since early April. The FLIRT variants are now responsible for approximately 75% of all COVID-19 infections in the country. These subvariants are characterized by specific mutations in their spike proteins, which enhance their transmissibility. For the week ending July 27, the CDC reported a national positivity rate of 16.3% for COVID tests, excluding at-home tests. This represents a 2% increase from the previous week. However, the distribution of positive tests is uneven, with Region 6, encompassing Arkansas, Louisiana, New Mexico, Oklahoma, and Texas, reporting the highest percentage of positive results. Region 7, including Iowa, Kansas, Missouri, and Nebraska, followed closely behind with a positivity rate of 17.8%. Region 4, which includes states such as Alabama, Florida, and Georgia, experienced the most significant rise in positive test rates, up 7.2% from the previous week. In contrast, Region 3, covering states like Delaware and Maryland, had the lowest infection rates at 11.1%, with only a slight decrease from the previous week. Despite the rise in infections, hospitalizations remain relatively low, as the FLIRT variants, while more infectious, generally cause less severe symptoms. The increase in COVID-19 cases has been mirrored by higher levels of the virus detected in wastewater surveys across 20 states. While the new FLIRT variants contribute to rising infection rates, their lower severity compared to earlier strains has kept hospitalization rates in check. Public health officials continue to emphasize the importance of isolation and monitoring symptoms to mitigate the spread of the virus.